Hello everyone, I'm back with today's video on case taking in homeopathy. This video will be helpful for all first to fourth year BHMS students to frame the long answer question and also have a basic knowledge of case taking in homeopathy. Starting with the introduction of homeopathy. Homeopathy is a holistic system of medicine founded by Dr. Samuel Hahnemann in the late 18th century. It emphasizes the individualized treatment of patients based on principle of like cures like. Now, what is the purpose of case taking? The primary goal of case taking in homeopathy is to uncover the totality of symptoms which is experienced by the patient. This involves the chief complaint, concomitant symptoms, modalities and the patient's general state of health. I hope सबको पता है कि modalities क्या होता है. Modalities are factors that worsen or alleviate the symptom. For example, pain in head aggravated by sun, aggravated by noise, ameliorated in dark room. These are the modalities. And concomitant symptoms are additional symptoms that accompany the chief complaint. Moving forward to components of case taking. First is the chief complaint. सबसे पहले हमें चीफ कंप्लेंट से स्टार्ट करना है कि पेशेंट हमारे पास आया है तो किस कंप्लेंट से आया है, एंड दैट हैज़ टू बी टेकन इन दिस फॉर्मेट LSMC. सेकेंड इज़ द हिस्ट्री ऑफ प्रेजेंट इलनेस. जो भी चीफ कंप्लेंट है या उसके अलावा जितने कंप्लेंट्स है उसे हमें ODP में क्लासिफाई करना है, ऑनसेट, ड्यूरेशन एंड प्रोग्रेस, सो दैट हमें हर एक सिम्टम का कंप्लीटनेस समझ में आएगा LSMC एंड ODP के थ्रू. थर्ड इज़ एनी पास्ट मेडिकल हिस्ट्री, any previous illnesses, surgeries and medical treatments will give the patient's health background. Fourth is the family history. Any history of any diseases in family that might affect the patient's current health condition is very important. Mental and emotional state. Understanding the patient's emotional temperament, stress factors, fear and coping mechanisms, they are very crucial in homeopathic remedy selection. Sixth, last but not the least, is physical examination. Now comes the importance of case taking in homeopathy. Case taking in homeopathy is crucial because it forms the foundation of the entire treatment process. The reasons why case taking is so important in homeopathy are: first, individualized treatment. Homeopathy treats each person as a unique individual with their own set of symptoms, experiences and health history. Therefore, case taking allows the homeopath to understand the totality of symptoms, including physical, emotional and mental aspects. Second is the holistic approach. Homeopathy believes in treating the whole person, not just the disease or specific symptoms. Through detailed case taking, the homeopath gathers information about the patient's lifestyle, stress factors, past medical history, family history, and many more. This holistic approach helps in identifying the underlying causes of illness and promoting overall well-being. Third is the identification of key symptoms. Homeopathic remedies are prescribed based on the principle of like cures like, that is similia similibus curantur. Case taking helps in identifying the symptoms that are most characteristic and peculiar to the individual. Fourth is the monitoring progress. The initial case taking provides a baseline against which the patient's progress can be measured during follow-up consultations. Changes in symptoms can be either with improvements and aggravations. They are important indicators that will help the homeopath to assess the effectiveness of the remedy. Fifth is the avoiding suppression. Homeopathy aims to stimulate the body's own healing mechanisms. Understanding the complete symptom picture through thorough case taking helps in selecting remedies that encourage the body to resolve symptoms naturally rather than just suppressing them. And effective case taking will involve active listening, and obviously that will build a proper rapport with the patient. Sixth is detailed history gathering. Case taking involves gathering a detailed history of the patient's present complaints, past medical history, surgical history, medication history, sleep patterns, temperaments, fear, dreams, and any other significant life events. This approach helps the homeopath understand the factors that contribute to the patient's current state of health. Seventh is confirming the similimum. The similimum refers to the remedy that most closely matches the totality of patient symptoms. Effective case taking helps the homeopath narrow down the possible remedies and confirm the similimum, which is essential for achieving results. And last is continuous evaluation. Beyond the initial consultation, case taking continues throughout the course of treatment. Follow-up allows the homeopath to evaluate the patient's progress, reassess symptoms, and adjust the posology and remedies as necessary. Now comes the do's and don'ts of case taking. First, we'll see the do's of case taking. First point is detailed case taking. The patient's detailed history should be taken. Now there are three sources from which the symptom can be extracted. First is the patient himself. Second, the attendant can give the symptom or the data. And third is the physician himself. Now, patient and attendant symptoms are known as subjective symptoms, and the symptoms which are observed or noticed by the physician are known as objective symptoms. Third is exact expression and words used by the patient should be written down accurately. At the beginning, the physician advised them to speak slowly. The physician should begin every new symptom on a fresh line. Special questions are to be asked only when the physician feels that the peculiar and uncommon symptom of the case has not yet come out in case taking. While physician is dealing with one symptom, he should confine the symptom, and physician should take the case using his sound senses. The don'ts of case taking are: avoid leading questions, never ask direct questions, yes or no questions, never ask alternating questions, never skip from one symptom to another randomly, as it may confuse the patient and scatter the physician idea as well. Do not hurry a patient in his narratives. Let him complete the symptom, let him complete his narratives. Do not use complicated medical terminologies. Do not hide anything from the patient, and do not rely on patient statement entirely. So thank you everyone. This was all about case taking in homeopathy. I hope this was helpful to you. Case taking in acute diseases, chronic diseases, pediatric and geriatric cases will be discussed in further videos. Till then, comment if you have any questions and stay tuned for more such videos.